Starting with the introduction, spectrum of disease occurring in the orbit is vast and are the microsome of rest of the body. Its diagnosis is a great challenge for ophthalmologists, ocular pathologists, and radiologists. Cystic lesion of the orbit are a heterogeneous group of conditions that may vary greatly in presumed cause, presentation, and pathological appearance. It accounts for 10 to 30% of non-thyroid orbital lesions. These lesions are mostly congenital and benign in nature. Aim of our study was to describe the clinical radiological presentation and treatment outcome of cystic disorder of the orbit. It was a prospective interventional case study done over a period of 3 years, and all the histologically proven cystic lesions were included in our study. Treatment included surgical excision for these cases. So, depending upon the location of the orbital cyst, the most common location was the extracorneal space, accounting from 86.67%, and out of those cases, superior nasal orbit was the most common location. And according to the histopathological type, epithelial cysts were more common as compared to the non-epithelial cyst, and among the epithelial cysts, dermoid cyst was the most common we found. Some of the rare entities that we found were the bilateral microophthalmos with the cologomatous cyst, which occurs because of the failure of closure of choroidal fissure. Then there was a case of cystic teratoma, which are rare embryonal choristoma. 1% of the orbital tumors in childhood are teratomas. 2 teratomas arise from all the 3 germ layers. Then hematic cyst, which occurs secondary to hemorrhages within the pre-existing lesion, like the lymphangiomas, or cystic hematoma, which is because of the extravasation of blood in the subperiosteal space, and which can be either spontaneous or traumatic. So for small lesions, we did not did any intervention, but for large lesions, surgical excision was required. Then mucosila, benign, chronic, expansile, locally destructive cystic lesion of paranasal sinuses. It occurs secondary to obstruction of the normal drainage pathway of paranasal sinuses. The sinus mucosa continues to produce mucus and accumulate in the closed cavity, causing this lesion, and 90% are frontal and frontoethmoidal mucocele. So I would like to conclude that apart from aesthetic effects, orbital cysts during their growth can cause motility disturbance and optic nerve compression syndrome. Always suspect cystic disorder if a child is present with microophthalmos and displaced eyeball. Dermoid cysts are the most common congenital epithelial cysts. Mucocele are cystic disorders of paranasal sinus. Secondary affecting the orbit may lead to visual impairment. So ultrasonography, CT scan, and MRI are important diagnostic modalities for these cases. Thank you so much.
That's a wonderful presentation, Dr. I think
Shivangi.
See, the thing is that, what is called sclerosing agent. Any patient you tried or sclerosing agents, you told something like a small lesions.
Yes.
Did you try anything called sclerosing agent?
No, sir. We only reported the cystic lesions, sir.
And after cystic lesions removed, so you told microophthalmas. Did you any expanders were used here? How about the expanders?
Explanters,
Yes.
sir? No, sir.
Okay. So how many patients lost the vision in these cases?
It's about 40 patients, sir.
Any questions?
What was the indication of, in case of bilateral microphthalmia with cyst, what was the indication of removal of the cyst?
Ma'am, if the age is less than 5 years, then we do not remove it because it will cause contracted socket. So we waited till 5 years of age till we can go for excision.
You did not use the sclerosing agent?
No.
Your inclusion criteria should have been cystic lesions on imaging rather than histopathology.
Right. Okay. Thank you.